This podcast covers the muscles of the foot and the ankle. First of all, we're going to talk about the anterior tibial muscles. These are the muscles that dorsiflex and extend the toes. The first distinction to make is between an intrinsic and an extrinsic muscle. An extrinsic muscle starts in the leg and goes into the foot. An intrinsic muscle starts and ends in the foot. So the muscles that I'm going to concentrate on are the extrinsics. The first one is tibialis anterior, which, as the name suggests, is on the front of the tibia. It comes from the tibia, the area adjacent to the head of the fibula, and the interosseous membrane, the membrane between the bones. Its muscle belly passes down, turns into a tendon, and that tendon goes on the front of the ankle, and it goes medially to the base of the first metatarsal and the medial cuneiform. It dorsiflexes and it inverts. Its main role is to act as a brake or a decelerator when the foot hits the ground, and it lowers the foot down gently to the ground, a little bit like an aeroplane landing, back wheels first and then the front wheels coming down slowly. If we take off tibialis anterior, there are two more small muscles underneath. There's one that lifts the big toe up and one that lifts the other toes up. They come from the anterior part of the tibia and the fibula. Long, thin muscles and tendons go down the front. They go, in the case of extensor hallucis longus, to the base of the big toe, and in the case of extensor digitorum longus, to the other four toes. Because they are at the front of the ankle, they will dorsiflex, and because they are on top of the foot, they will extend the toes also. We now go to the lateral side of the leg, and we have two main muscles called the peroneae. We have peroneus longus and peroneus brevis. Peroneus brevis comes from the area just below the head of the fibula. It passes downwards on the outside of the leg, and it goes behind the malleolus, under the groove in the cuboid, and under the sole of the foot, and attaches to the base of the first metatarsal and the medial cuneiform. So when it contracts, because it goes behind the axis of the ankle joint, it will plantarflex, and it also everts the foot. Peroneus brevis is similar, but it comes from lower down, and it goes to the base of the fifth metatarsal, that bump that you felt in the first few weeks of term. And again, it's a plantarflexor and an everter. Think of them as the zip on a pair of knee-high boots. That's what the peroneae do. There is also one called peroneus tertius, which is kind of an extensor tendon on the dorsum of the foot. Some people don't even have one of those, so I'm not worried about that really. If we now go to the back of the leg, we have two main muscles in the calf. We have gastrocnemius and soleus. Gastrocnemius goes across the back of the knee joint, so it will flex the knee. It's got two heads, a medial and a lateral head, and they come from just above the femoral condyles. The muscle belly goes down, turns into a tendon, and inserts into the calcaneus, forming the Achilles tendon. So gastrocnemius flexes the knee and plantarflexes the foot. If you took gastrocnemius off, underneath that you'd have soleus. Soleus starts below the knee, so it can't do anything to the knee joint. It doesn't realize that there is such a thing as the knee joint. It starts on the soleal line, and it comes from an arch-shaped attachment on the fibula and the tibia and the interosseous membrane. It comes down, joins to the tendon of gastroc, and the two together form what's sometimes called the triceps surae, or the triceps of the leg, and you've got these two muscles that form the Achilles tendon. If we take those off, there are a lot of deep muscles underneath, quite thin muscles. So in the same way that there was a tibialis anterior, there is a tibialis posterior, which is a long thin muscle that comes from between the tib and the fib, passes downwards, goes behind the medial malleolus, and goes under and attaches to basically every bone it can find in the foot. So it's an inverter because it's on the inside, and it will plantarflex as well. If we take those off, we have two more flexors. We have flexor hallucis longus and flexor digitorum longus. Not as concerned about these, but they come from the tibia and the fibula, pass downwards, go behind the sustentaculum tali, which is this scaffold of bone, and then flexor hallucis longus goes to the base of the big toe, and flexor digitorum longus goes to the other 4 toes. If we go back to look at the dorsum of the foot, or the top of the foot, above where the cuboid is, there's what looks like a greenish blue bruise. That's actually a muscle, and it's a muscle called extensor digitorum brevis. If you pull your toes up, it goes hard, so it's not a bruise, it's actually a muscle. In the foot itself, there are 8 billion muscles in 5 billion different layers with 3 billion different names. When I was a student, we had to learn them all. I'm going to spare you that.